But frankly, the easiest thing to do for the physician is to ask, do you have problems with sex? That's the screen. And if the answer is yes, then that leads to more questions. And then let's turn around from a patient perspective. As a patient, you have to take responsibility for your own health. And if you go to the doctor without a plan, a lot of things that you want to get addressed won't get addressed. If you have problems with sexual function as a man or woman, there are many, many good treatments available. But you have to ask, right? You have to be bold. You have to be courageous. You have to say, hey, I've been struggling with this. What do you think this means? And if you do that, there's many benefits that will come from that question. And as physicians, we need to do a much better job of asking routinely about this. The first time I ask a patient, they may be embarrassed, they may be shy. But then the second time that I ask them, or the third time, now it becomes normalized. And now maybe they'll reveal this part of their life where they're hesitant to talk about. The other thing that often happens in modern day medicine is patients will come and they won't ask the question until the last 30 seconds. The proverbial hand on the doorknob question, right? So you have a set amount of time with your physician in modern day medicine. And as the doctor's leaving, they say, oh, by the way, there's this as well. Don't do that because you shortchange the ability to ask further questions to get good treatment. Ask the important stuff first.
That makes a ton of sense. And people come to you as a urologist at Mayo Clinic who is an expert in sexual health. They are coming to you. They might come and talk about their dog and all these other things, but at the end of the day, they are probably there and very motivated. Are you seeing erectile dysfunction increase in our youth?
In general, as our society gets less healthy, clearly erectile dysfunction rates will go up. All right. Again, if you look at metabolic disease disorders, diabetes, obesity, cardiac disease, these are all increasing with our society. And as these go up, problems with erections will occur as well. I mean, if you think about it, the body has a primary job of protecting the brain and everything that supports the brain function. And as we become unhealthy, it makes intuitive sense that the body is willing to sacrifice a few of the organ systems here or there, whether it's fertility or erections, which aren't essential to keep you alive in that moment, right? And so, as an example, if a patient has cancer, they'll have a low sperm count, right? Because the body is diverting resources to take care of the primary problems. It doesn't have time to nurture the penis and keep that part healthy. So it makes intuitive sense that as we become healthier, problems with erections also occur. The other thing is, psychogenic ED. So psychogenic means like performance anxiety. Now, 50 years ago, when Masters and Johnson started doing groundbreaking research on sex, they said 90% of problems with erections is in the man's head, okay, and 10% is organic.